Wisconsin's Commissioner of Insurance has announced that rates in Wisconsin for 2018 will increase on average of 36%. I'm Bryn McBride of ABC for Health. Their announcement also let you know that there are many tax subsidies that help offset that increase. But the bigger bang was coming out of the fact that cost-sharing reductions have been defunded, at least for the moment, by the federal government. And that is the excuse the insurance companies are using for increasing premiums. On average, 36%. Now, that is an average. Some increases in plans offered in Wisconsin in the marketplace have very slight increases in premiums. Others have much more dramatic increases. Folks that are between 100 and 400% of the federal poverty level, which is about 90% of the people buying their insurance in the marketplace, will get the benefit of increased tax subsidies to help offset that rate increase. Now, the folks that will feel the pinch of this premium hike in Wisconsin will be those that are a little bit higher income, those over 400% of the federal poverty level who are not eligible for tax subsidies. The Wisconsin insurers filed their rates assuming there would be no cost-sharing reductions, which meant that they were not going to be able to pass on savings to consumers in forms of lower deductibles and lower out-of-pocket costs. Now, because premiums are up, that means tax subsidies are up. And we do also have a question whether or not Wisconsin's insurance commissioner is taking rate review very seriously. Any rate increase over 10% is by definition in the Affordable Care Act considered unreasonable. There was no mention of reasonableness in the Commissioner of Insurance's comments. They did share other things with us, though. In a press release that was issued by the Commissioner of Insurance on October 12th, we saw not just the rate increase numbers, but we also saw an interactive coverage map. We link to that here so you can get an idea of the plans that are offered in each county throughout the state of Wisconsin. They also identified the second lowest silver plan. So this is the silver plan that has the second lowest cost in the marketplace. This is what all other premium rates are based off of. This is that benchmark plan. That's a kind of a middle of the road benchmark for one which you can kind of get a sense of where the cost is associated. Now, silver plans are those that will be having a very large premium increase this coming enrollment season. Folks are encouraged to shop around. One of the plus sides of the Commissioner of Insurance press release is that they do encourage shopping in the marketplace. Auto enrollment is a feature this year, which means if your insurance plan left the marketplace for 2018, you will be auto enrolled into the next closest plan, a plan that looked a lot like the one that you had before. Now, that could mean, however, a different network, different premiums, and different cost sharing. So you will want to look very closely. Use auto enrollment as a last resort. There are about 75,000 individuals that will be auto enrolled if they were to do nothing during open enrollment. The Commissioner of Insurance made that number publicly available. They point to insurance companies leaving the marketplace like Molina in some of the counties in Wisconsin as the reason why so many folks will be eligible for auto enrollment. But everybody is eligible to shop for a plan and pick the one they want. Auto enrollment will be a last resort, so at least people are not uninsured come 2018. You can read the press release and some of these coverage maps for yourself, and you can also share a discussion with us. Share your healthcare story, send us an email, or ask us a question. And you can do all of that on our website at healthwatchwisconsin.org. Thanks for joining us.